Signature moments, 5 stages of experience that we can think about where we might insert a signature moment, from attracting, entering, during, exiting, and extending. Within our own kind of greater healthcare industry, Sharp Healthcare in San Diego Hospital sends a personal note, handwritten note, to every patient after they've visited the hospital. Okay? So if they can do it in a place with probably 500 to 1,000 employees, I believe you can do it in your practice of, 5 to 50 people. Similar thing, handwritten note, signature moment. So where can you insert signature moments? You think about the different things that you do, what the welcoming ritual's like into your practice, okay? What it's like on procedure day, co-management day, dispensing day, what happens in follow-up exams, and what happens long afterwards. And I know some of the other talks, I looked at the titles, what Joe and Mike are going to be talking about, how we extend that experience of iMaginations into the home, which is the whole rationale behind the home offering that you're going to be learning more about during this conference. Phenomenal. Get into that long afterwards. How we create top of mind for our practice when the patient's not with us, okay? Calling patients afterward. How do you like your glasses? How are the lenses working for you? How was LASIK for you? Should be done, routine. They can become signature moments. People say, wow, I got a phone call. Because it's so, see, healthcare is so bad, nurse ratchet is so prevalent in healthcare and medicine that if you just do a little bit to be better, you'll have phenomenal results. But you got to be willing to spend the time. More than the money, it's the time. And to say, yeah, this stuff's for real. And there's too many examples of this going on, even with ophthalmic practice we're working with, to say that this doesn't work. Absolutely works. One example I'll give you, Mark Contos, a surgeon of mine in Coeur d'Alene, Idaho, and for those of you who don't know where that is, the red arrow points to it in the upper northwest. He started doing, he's an eye surgeon, does LASIK and cataract, and he found out about Kiva. Kiva is the online, it's the ability to go in and donate $25 to the woman in Samoa who's trying to buy a boat, and she needs 800 bucks, and you can contribute 25 bucks. Changing the charitable giving experience. I've written about this nonprofit, phenomenal. He said, I'm going to take this into my practice, and instead of giving the patient a t-shirt and a mug that has the practice name on it after LASIK, I'm going to give them a $25 Kiva certificate and let them go home, or we'll help them in the office, pick a charity they want to donate to, and I'll pay the 25 bucks. I said, how's it going? He said, half the patients kind of don't get it. But he said, half really get it. And they're talking about it in the community, and they're saying, you're not going to believe what this doctor did. And he said, there was one patient that was so moved by this, he said, I took your 25 and I had 1,500 of my own, because I'd never heard about this thing. And I heard about it because our daughters are in the Indian Princess YMCA program, and we do this as part of giving back. I mean, you could be doing this in your practice. Things like this. And charitable giving and the ability to now, it's something greater than ourselves, works on so many levels, and I applaud him for doing that and having an impact around the world, helping people who are less fortunate than ourselves.